Hello students, subscribe the Fundamental Pharmacy and press the bell icon for more videos.
Hello students, join our online course for GPAT Niper Drug Inspector to get assured amazing rank.
Hello my dear students, welcome back to the Fundamental Pharmacy. Today we are going to see classification number 28, antibacterial drugs or antibiotics or chemotherapeutic agent part 2. We already seen classification of antibacterial drug according to the mechanism of action. We have also seen some historical backgrounds. Now this is a classification number 28. That means we have already seen 27 videos on the classification. If anybody has not seen previous videos, please go in the channel's playlist and watch all the classification videos, because these videos, they are very important for your GPAT Niper Drug Inspector and Government Pharmacist exam. So I would like to request you, please watch this video until end, and believe me, lot of MCQs they are going to be covered just by watching these videos, because in these videos I am not only explaining the classification, but also I am also explaining few important points for the exam. These videos are very important, and I would like to request you again, please go and watch all the classification videos. My dear students, we have already seen classification by mechanism of action or antibiotics. So antimicrobial drug or antibiotics, they are a broad term. So antimicrobial drugs or antibiotics, they are classified in a different way. So first way to classify the antimicrobial drug is nothing but the according to the site of action. Antimicrobial drug कहाँ पे act हो रहा है, according to that they are classified. So according to the site of action, whether the drug is acting on a cell wall, whether the drug is acting on a cell membrane, whether the drug is acting on ribosomes, or whether the drug is acting on enzyme. So depending on that they are classified. So according to the site of action. So example, drug acting on a cell wall पे कौन act होता है? So for example penicillin, cephalosporins and few antifungal antibiotics, right? Second, on the cell membrane के ऊपर कौन act होता है? For example few antifungal antibiotics. Ribosome के ऊपर कौन act होता है? All the drugs which inhibit the protein synthesis, they act on a ribosomes. For example tetracyclines, aminoglycosides, then macrolides, they are known as a protein synthesis inhibitors. So they act on a ribosome, that is a RNA. Now there are certain antibiotics which act on enzymes. तो एंजाइम्स के ऊपर कौन एक्ट करता है? फॉर एग्जांपल सल्फोनामाइड्स, दे आर अ फोलिक एसिड एंटागोनिस्ट, देन methotrexate and certain DNA kinase inhibitors, DNA polymerase inhibitors. So all they act on a enzyme. So according to the site of action, antibiotics are classified in a different way, like cell wall synthesis inhibitor, cell membrane leakage causing, then protein synthesis inhibitor, then DNA kinase inhibitors, DNA polymerase inhibitors, folic acid synthesis inhibitor, like that. Okay. Again, antimicrobial drugs, they are classified according to the spectrum of activity. So according to the spectrum of activity means whether they are active against a particular type of organism or whether they are active against the different types of organism. So if antibiotic is able to inhibit or able to kill the bacteria of variety of type, अगर एंटीबायोटिक बहुत सारे टाइप के बैक्टीरिया को मारता है तो उसको बोलना है आपको ब्रॉड स्पेक्ट्रम एंटीबायोटिक. सो इफ एंटीबैक्टीरियल ड्रग और एंटीबायोटिक or it is active against the variety of organism known as a broad spectrum antibiotic. For example tetracyclines, aminoglycosides, they are known as a broad spectrum antibiotic. Chloramphenicol is also. Then narrow spectrum antibiotics means what? Narrow spectrum antibacterial drug, that means they particularly active against the a particular type of organism. ये क्या करेंगे? particular type के organism के ऊपर ये act होते हैं. For example penicillins, they only act on a gram positive bacteria, right? So that's why they are known as narrow spectrum antibiotics. So broad spectrum means they are active against the variety of antibiotic, variety of antimicro. Broad spectrum means these antibiotics are active against the variety of organisms. Narrow spectrum means they are only active against the particular class of organisms, right? Now antimicrobial drugs, they are also classified according to the chemical structure. तो उसका chemical structure क्या है? उसके chemistry, according to the chemical structure, they are classified into beta lactam antibiotics. So in that you have beta lactam ring, for example penicillin, cephalosporins, monobactam, like that. Then aminoglycosides, gentamicin, amikacin, etc. Then macrolides antibiotics, macrolide antibiotics, in that you have all the azithromycin, roxithromycin and all that. Then quinolone antibiotics, यहाँ पे quinolone ring होगा, that's why quinolone antibiotics. In that you have all the ciprofloxacin, norfloxacin, nalidixic acid, etc., etc. Then polypeptide antibiotics, so it is a peptide, so polypeptide antibiotics, for example polymyxin B, etc., etc. Then azole antibiotics or azole antifungal drugs, they will have azoles in the structure, miconazole, fluconazole, itraconazole, etc. Then sulfonamides, in that you will have sulfonic acid derivative. Okay, so according to the site they are classified differently. According to the spectrum of activity, antibiotics are classified differently. According to the chemical structure of drug, they are classified in a different type. Now according to the type of organism against which they are active, they are known as antibacterial. So these antibiotics will be active against the bacteria. Antiviral drugs, they are active against the virus. Antifungal means they are active against the fungus. Antiprotozoal means they are active against the protozoa. So likewise that, so antimicrobial drugs are classified in a different way according to the site of action, according to the spectrum of activity, according to the chemical structure, according to the type of organism against which they are active. Again, antibiotics are classified according to the type of action. So according to the type of action means what? Whether they are able to kill the bacteria or whether they inhibit the growth of bacteria. तो अगर एंटीबायोटिक बैक्टीरिया को किल करता है तो उसको बोलेंगे बैक्टीरिसाइडल एंटीबायोटिक. और अगर एंटीबायोटिक और एंटीबैक्टीरियल ड्रग सिर्फ बैक्टीरियल ग्रोथ इनहिबिट करता है तो उसको बोलेंगे बैक्टीरियोस्टैटिक एंटीबायोटिक. So bacteriostatic antibiotic and bactericidal antibiotics, right? So for example, bacteriostatic is nothing but the all the proteins in this inhibitor, they are a bacteriostatic antibiotic like tetracyclines. Okay, bactericidal means they kills the bacteria. For example, penicillin, cephalosporins, they are bactericidal. Different, there are different ways to classify the antibiotics. So according to the site of action, according to the spectrum of activity, according to the chemical structure, according to the type of microorganism, according to the type of action. Okay, now we'll see the classification of antibiotics according to the chemical structure. So according to the chemical structure or depending on the chemical structure, antibiotics are classified in different way. Chemical structure कैसा है उसके accordingly different class है. For example, first one is sulfonamides, or they are known as sulfa drugs. Sulfonamides and related drugs, sulfa drugs. So in that you have sulfadiazine, sulfapyridine, sulfadimidine, sulfamethyltazole, sulfoxazole, sulfamethoxazole, etc., etc. Dapsone is there, para-aminosalicylic acid is there. So dapsone, dimethyldiphenosulfone, and para-aminosalicylic acid. So this dapsone is used in the leprosy. Then para-aminosalicylic acid is also used in the leprosy. You have to remember. There are certain, we have different classification. Sulfur drugs also classified differently. We have separate classification on the sulfonamides. So we'll see in upcoming sessions. Now second class according to the chemical structure, diaminopyrimidine derivative. So remember there was a question once. इसके ऊपर क्वेश्चन आ चुका है diaminopyrimidine derivative. कौन है? Trimethoprim and pyrimethamine. So these are the antibacterial drugs which are a diaminopyrimidine derivative. Now third class according to the chemical structure, quinolone antibiotics. So these antibiotics will have quinolone ring structure, मतलब quinine structure plus ketone. So quinolone. So in that you have nalidixic acid, norfloxacin, ciprofloxacin, gatiploxacin, gemfloxacin, atorvastatin, and moxifloxacin. Right. So there are different drugs in this. So out of that, nalidixic acid is a quinolone derivative, and other floxins are nothing but they are known as a fluoroquinones. They are a DNA gyrase inhibitor and they are used in the treatment of urinary tract infection and respiratory tract infection. Now according to the chemical structure, fourth type of class of antibacterial agent, तो उसमें चौथा आता है बीटा लैक्टम एंटीबायोटिक्स. So in that you will have beta lactam ring. इसमें बीटा लैक्टम रिंग रहेगा. So for example penicillins, in that you have different class of penicillins. पेनिसिलिन के ऊपर ही अलग क्लासिफिकेशन है. we'll see in upcoming sessions. Now cephalosporins का भी अलग क्लासिफिकेशन है. So penicillin, cephalosporins, monobactam, carbapenem, all they belongs to beta lactam antibiotics. So normally क्या होता है कि बहुत सारे बच्चों को बीटा लैक्टम एंटीबायोटिक बोला तो उसको फटक से दो टर्म याद आती है. कौन से? cephalosporins and पेनिसिलिन. बट आपको यहाँ पे याद रखना है कि मोनोबैक्टम्स भी उसमें ही आते हैं, कार्बापेनम भी उसमें ही आते हैं azithromycin etc. Depending upon the chemical structure, antibiotics are classified into fifth class known as a tetracyclines. So in this tetracyclines you will have four benzene rings fused together. So two anthracene ring fused together or four benzene ring fused together known as tetracyclines. In that you have all the tetracyclines: oxytetracycline, democycline, okay, chlorotetracycline, doxycycline, etc., etc. They are proteins in this inhibitor. Now according to the chemical structure, sixth class of your antibiotic is nothing but the nitrobenzene derivative. तो सिक्स क्लास होता है नाइट्रोबेंजीन डेरिवेटिव. देखो इसके ऊपर क्वेश्चन आ चुका है. सो क्लोरोमफेनिकोल इज अ नाइट्रोबेंजीन डेरिवेटिव. एज क्वेश्चन आ चुका है इसके ऊपर, यू हैव टू रिमेंबर क्लोरोमफेनिकोल इज अ नाइट्रोबेंजीन डेरिवेटिव. ओके. Again, seventh class according to the chemical structure, that is aminoglycosides. So aminoglycosides means what? यहाँ पे ग्लाइकोसिडिक स्ट्रक्चर होगा, एक अमाइनो शुगर होगा एंड एक ग्लाइकोन पार्ट होगा, तो वो दोनों ज्वाइन होंगे बाय ग्लाइकोसिडिक पार्ट. सो aminoglycosides. So in that streptomycin, gentamicin, amikacin, neomycin, etc., etc. They are protein synthesis inhibitor. Remember, they have numerous adverse effects like neurotoxicity, okay, then ototoxicity, then nephrotoxicity, etc. Next one is nothing but the according to the chemical structure, macrolide antibiotics. In that you will have large lactone ring. Macro मतलब क्या? Macro मतलब large. Lide मतलब क्या? Lactone. So macrolide means they will have large lactone ring in their structure. For example, erythromycin, azithromycin, clarithromycin, roxithromycin, etc., etc. Now, according to the chemical structure, next class is a lincosamide. So examples के ऊपर क्वेश्चन आ चुका है. So clindamycin, lincomycin, they are the lincosamide. Clindamycin and lincomycin, they are the example of lincosamide antibiotic. Glycopeptide antibiotics. As the name indicates, glyco means sugar, peptide means protein. So glycopeptide antibiotics, for example, vancomycin, then ticoplanin. These are the glycopeptide antibiotics. Example आपको याद रखना है. Then oxazolidine diones, in that you have linezolid. क्वेश्चन इसके ऊपर भी आ चुका है. oxazolidine dione, linezolid, it is a broad spectrum antibiotic, reserved drug for a particular purpose, right? Now next class is nothing but the class number 12, polypeptide antibiotics. तो obviously इसमें क्या होगा? पेप्टाइड होगा. So polymyxin B, then colistin, then bacitracin and thyrothricin. These are the examples, right? Next class is nothing but the nitrofuran derivative. इसमें नाइट्रो होगा और फ्यूरन होगा. So all these are the antiprotozoal agents. So in that you have nitrofurantoin and furazolidine. Nitrofurantoin is used as a urinary antiseptic. Furazolidine is used as a GIT antiseptic in the treatment of diarrhea. So ये UTI में यूज करते हैं नाइट्रोफिराटोइन, और ये किस में यूज करते हैं? डायरिया में. Now next class is nitroimidazoles. In that you have antiprotozoal drug like metronidazole and tinidazole. So metronidazole, tinidazole, they are the nitroimidazole derivative. They are the antiprotozoal drugs. Next class आपका आता है nicotinic acid derivative. So in that you have isoniazide, pyrazinamide and ethionamide. So ये जो nicotinic acid derivative है, they all are used in the treatment of tuberculosis. So isoniazide is a first line agent, pyrazinamide is a first line agent, ethionamide is second line agent. Next class आएगा आपका polyene antibiotic. So in that nystatin, amphotericin B and amycin. So they have polyene means what? Polyene means number of double bonds. So polyenes. So alkene जो होता है alkane, alkyline. Alkene मतलब क्या? Alkane मतलब कार्बन सिंगल बॉन्ड. alkene मतलब क्या? कार्बन डबल बॉन्ड. alkyline मतलब क्या? कार्बन ट्रिपल बॉन्ड. सो पॉलीइन मतलब क्या? पॉली मीन्स बहुत सारे, इन मतलब क्या? अल्कीन. सो बहुत सारे कार्बन डबल बॉन्ड्स. सो दैट इज नोन एज अ पॉलीइन एंटीबायोटिक्स. सो इन दैट यू हैव nystatin, amphotericin B and amycin, right? So क्वेश्चन इसके ऊपर भी आता है. Now 17th class is nothing but the azole derivative. तो इसमें azole आएगा. Okay, so in that all these are the antifungal drugs: miconazole, ketoconazole and fluconazole, itraconazole, etc. Fluconazole is also there. Okay, now miscellaneous or other purpose antibiotics: rifampin is there, streptomycin is there, ethambutol, cycloserine, thiazidazone, clopazanamide, griseopulin. So out of that, griseopulin is an antifungal agent. Clopazanamide is a drug used in the treatment of tuberculosis or leprosy. Mostly leprosy में use किया जाता है, tuberculosis में use करते हैं. Ethambutol is a drug used in the tuberculosis. So this is the classification according to the chemical structure of antibiotics. बहुत ही important question, बहुत बार आ चुकी. So we'll see another class again. Next. So antimicrobial drugs, again you can see first one is a beta-lactam antibiotics. Beta-lactam antibiotics. In that you have first penicillins, cephalosporins, then carbapenems, carbacephums and monobactam. So monobactam, carbapenems, cephalosporins and penicillins. So all these are the antibiotics containing beta-lactam ring. So beta-lactam antibiotics, penicillin, cephalosporins, carbapenem, carbacephum and monobactam. So examples. Penicillins also have different classification. In that also we are going to see separate classification of penicillin. We are going to see separate classification of cephalosporins. For example, benzyl penicillin is there. It is also known as penicillin G. Then ampicillin is there. Amoxicillin is there. Methicillin. Methicillin is an acid-resistant penicillin. Then cloxacillin, nifacillin, carbapenicillin, ticarcillin, azocillin and piperacillin. So out of that, ticarcillin, azocillin, piperacillin, carbapenicillin, last four are known as extended spectrum penicillins. Last वाले जो है they are known as extended spectrum penicillins. तो इसमें और भी क्लासेस है जैसे natural penicillin, semi-synthetic penicillins and synthetic penicillins. At that time I will see you. Now second is a cephalosporin. In that you have cephalaxin, cephazolin, cefuroxamine, cefaclor, ceftriaxone, ceftazidime, cefiprom and cefipime. These are the cephalosporins. Carbapenem, in that you have imipenem, meropenem and itapenem. So out of that, meropenem, imipenem is very very important. They are ICU drugs. They are used in the terminal stage. Other drugs are failed to control the infection. Then meropenem is used. Carbapenem you have locarpib. Monobactam में आता है azithromycin. So इसके ऊपर क्वेश्चन आ चुका है. So monobactam is nothing but the azithromycin, right? Now second class of antibiotic is nothing but the quinolone antibiotics. Quinolone antibiotics or fluoroquinolone antibiotics. So in that you have nalidixic acid. It was the first member of quinolone family, and this is a quinolone pure. Now cynoxacin is also quinolone only. Oxalic acid is also quinolone antibiotics. So quinolone में क्या आएगा? Nalidixic acid, cynoxacin, oxalic acid. So all these are the quinolone derivative. Out of that, all these are not used now. ये तीनों भी ड्रग अभी यूज नहीं कर रहे quinolones. So in that you have next generation fluoroquinones. So in that ciprofloxacin, norfloxacin, ofloxacin, sparfloxacin, provafloxacin, gatifloxacin, moxifloxacin. There are a lot of drugs. So again there is a separate classification of quinolones, and there are certain new drugs like streptogramine, cunepristin, then defopristin, oxazolin, dions में आता है आपका linezolid. Okay, first class was a beta-lactam, second was a quinolone, third was a newer drug, fourth one is a sulfa drug or sulfonamides. In that you have sulfixazole, sulfadiazine, sulfadoxime, sulfacetamide and sulfasalazine. So out of that, sulfacetamide is known as a ocular antibiotic. Then sulfadiazine, okay, silver sulfadiazine is used in the treatment of burns. Cotrimazole is a combination of sulfur drug plus trimethoprim, sulfamethoxazole and trimethoprim. ठीक है? So यहाँ पे it is known as a cotrimazole. 4:1 combination में इसको यूज किया जाता है. 4:1. You have to remember. Then next class is nothing but the macrolide antibiotics. In that you have roxithromycin, erythromycin, azithromycin, clarithromycin. So these are the macrolides. So out of that, clarithromycin is a drug of antibiotic of choice. Clarithromycin is an antibiotic of choice in case of H. pylori infection. You have to remember. Okay. Now erythromycin, roxithromycin, and azithromycin. Out of that, roxithromycin is the most potent. Then these are the macrolides. So then ketolide antibiotic. तो यहाँ पे ketolide है telithromycin. You have to remember telithromycin is a ketolide antibiotic, right? Now next one is the aminoglycosides. So in the aminoglycosides you have gentamicin, streptomycin, neomycin, amikacin, nitrilimycin and cisomycin. So out of that, streptomycin is a result drug for tuberculosis. Gentamicin is topically used also used in the injectable route. Neomycin is a topical drug. Amikacin is a systemic. Okay. Next one is a miscellaneous antibiotics. Miscellaneous antibiotics. In that you have glycopeptide antibiotic like vancomycin, teicoplanin, lincosamide like clindamycin, lincomycin. Then polypeptide antibiotic like polymyxin and colistin. Other antibiotics like bexitasine, sodium, fusidate and mupirocin. Okay, these are the miscellaneous antibiotics. Now again, broad spectrum antibiotics. Broad spectrum antibiotic कौन है देखो यहाँ पे. Broad spectrum means what? They are active against the variety of organism. Broad spectrum मतलब क्या? ये बहुत सारे माइक्रोऑर्गेनिज्म के ऊपर एक्ट होते हैं. For example, chloramphenicol is there, tetracyclines, okay, tetracyclines and chloramphenicol, they are a broad spectrum. Okay, so in tetracyclines में आता है oxytetracycline, chlorotetracycline, democycline, minocycline, etc. etc. Now this classification we will see again. Classification of antibiotics according to the type of action. First one is a bacteriostatic antibiotic. Bacteriostatic antibiotic मतलब क्या? Bacteriostatic means they will prevent the growth of bacteria. तो bacteriostatic means they only prevent the growth of bacteria. ये kill नहीं करेंगे, ये सिर्फ उसका growth inhibit करेंगे. So they inhibit only growth of bacteria, known as a bacteriostatic. So in that you have proteins this inhibitors. ये tetracyclines, tigecyclines, chloramphenicol, macrolide, lincosamides, linezolid. ये क्या करेंगे कि ये proteins in this को inhibit करते हैं. And that's why they are not acidal, they are bacteriostatic. Again, in the bacteriostatic drug affecting on DNA, nitrofurantoin, NOH, biosine. So they affect the DNA, but they are bacteriostatic. Drug affecting the metabolism. So for example, sulfonamides, dapsone, paramonosalicylic acid, trimethoprim, and ethambutol. So they are bacteriostatic. Now what do I mean by bactericidal? So they kills the bacteria. They are known as bactericidal. So in that you have proteins, this is inhibitor bactericidal. Aminoglycoside, streptogramin. Drug affecting the DNA which are bactericidal. Quinolones and metronidazole. Quinolones antibiotics and metronidazole. Then bactericidal polypeptide antibiotics. So in that you have polymyxin B, colistin, amphotericin B. तो देखो amphotericin B का बहुत सारा एडवर्स इफेक्ट होता है. पेरिफेरल न्यूरोपैथी, then super infection, etc. etc. So polypeptide antibiotic. Then cell wall synthesis inhibitor in the bactericidal. So in that you have phosphomycin, cycloserine, bacillacin, vancomycin, penicillin, cephalosporins. So first line agent for tuberculosis, first line agent anti-tubercular drug except ethambutol. So in that rifampin, isoniazid, pyrazinamide, streptomycin. So isoniazid का एक एडवर्स इफेक्ट होता है isoniazid का. So it can cause peripheral neuropathy. Isoniazid causes peripheral neuropathy. That is treated by vitamin B6. Now ethambutol causes optic neuropathy. तो ये जो ethambutol होता है ये optic neuropathy करेगा, अंधा कर देगा. Isoniazid क्या करेगा? Peripheral neuropathy. So peripheral neuropathy caused by isoniazid is treated by vitamin B6, that is pyridoxine. Rifampicin also causes orange coloration of urine, right? Streptomycin is again able to cause damage in the 8th cranial nerve. You can order this magic bullet for GPAT Niper DI Pharmacist exam. Read 2-3 times before exam and qualify 100% with best rank in a very short period. It's a guarantee. You can see we have very much promising results. Thousands of students they are placed in the Niper. You can also join our GPAT Niper 2024-25 online course where you will have live lectures, recorded lectures. All the lectures will be subject wise, chapter wise, giving more focus on the GPAT syllabus. Then study material will be provided at your doorstep in the form of hard copy. Online test series will be also there. Everything is included in the 8,000 rupees and validity for this course is 2 years. And if you get all India rank below 20 in the GPAT exam, your fees will be returned to you in the form of reward.
Hello students, order the magic bullet for GPAT Niper Drug Inspector, read twice and qualify 100